Rachel's pre-operative BMI was 99. We did put her on a very low calorie diet, but that still means her BMI was in the high 80s. In the past, these patients used to have a balloon to get their weight down, or would have a sleeve as a primary procedure and then have a secondary procedure 2 months down the line. We now have developed skills and the experience to be able to do gastric bypass in these super obese patients, and I think that's very important. The weight loss following a gastric bypass is much higher than any of the other bariatric procedures, and if we can do gastric bypass in these patients safely, I think it's much better for them. I think gastric bypass was the right option for Rachel on a number of levels. There are three main bariatric operations, as you know: the gastric band, the sleeve gastrectomy, and the gastric bypass. The weight loss after gastric bypass is currently the best we can achieve out of the three bariatric procedures, but more importantly, the risk of weight regain after a gastric bypass is very low. I think the operation went very well. I was expecting to take maybe 2.5 hours in this operation, but at the end I finished the operation in 1.5 hours, and I'm quite pleased about that. I'm quite mindful about the amount of time these patients spend under anesthetic. At the end of the day, my aim is to do the operation safely no matter how long it takes, but if I can economize on the time they spend under anesthetic, I think the outcomes are better. I would expect Rachel to lose approximately 20 to 30% of her weight at 6 months and maybe up to 50% of her weight at 12 months. The weight loss after a bypass is quite substantial. I would expect her to lose up to 70 to 80% of her weight at the end of three years or so. Rachel should start seeing dramatic improvements in her health. Rachel's operation went well. She was home in a couple of days. She has a lot of comorbidities, but most important of her comorbidities is her reduced mobility. I think as her weight starts going down, her mobility will start improving. Rachel also has obesity hypoventilation syndrome. As a part of this syndrome, she starts breathing almost 1200 times a minute. With the weight loss, her hypoventilation syndrome will start improving. Her breathing will start improving. I would expect her sleep apnea to resolve, 85% resolution in her sleep apnea by the end of 2 years. I would expect her mobility to be much better by the end of 1 year. I would expect all her health parameters to start improving by 6 months or so. NHS provides bariatric surgery. At the moment, only 2% of the eligible population are able to have their operation via the NHS. I think that's unfortunate. The difference we can make to people's life by doing bariatric surgery is huge. Many of our patients have hypertension, they have raised cholesterol, they have sleep apnea, they have cardiac disease, and they have diabetes. By doing bariatric surgery in these patients, we can have 70 to 80% resolution of these comorbidities. What I'm trying to say is the diabetes can improve in 80% of these patients at 2 years. If they were on 20 units of insulin, they'll probably be on 0 units of insulin at the end of 2 years. So here we have a set of operations which are very powerful, which can really improve a patient's health. And I feel the NHS should be funding more of these operations. These operations are of course available via private providers too. I think the quality of the operations is exactly the same. And patients who can't have the surgery on the NHS can still avail the benefits of these operations by having them done privately.